Okay, so I realize that the title of my talk is a little provocative, and especially for those who work in schizophrenia, probably wonder, what is she talking about? What, you have a new theory of schizophrenia? No, I don't have a new theory of, the entire disorder, but we do find a very interesting finding, and I believe that there is something for at least a subpopulation of patients. So without further ado, here's the action plan for me for today, for this presentation. I will have to start with schizophrenia, just a brief general introduction because I know some of you are not in the field. Then we'll talk, and it's kind of fortunate and unfortunate because afternoon people are a little sleepy after lunch, but almost everything was said, so I don't have to explain too much, like 2D, 4D digit ratio, so this is great. But I will talk briefly about sex differences in brain structure and function in the general population, and then return to sex and gender differences in schizophrenia. I highlighted both sex and gender, but in fact we have very, very little data on gender. So it will be primarily sex, but I will touch upon the whatever we know about gender differences. And finally end up with the potential mechanisms implicated in what we see. So, schizophrenia. Schizophrenia is probably one of the most obscure, the most complex, and most devastating, not only not only psychiatric disorders, but disorders of the central nervous system. Obscure because we still don't know the causes. We have various theories, but we still really don't know the causes of schizophrenia, and we still really cannot treat it adequately. We can diminish the symptoms, but we cannot cure it. And in 30% of people, we cannot do anything. And it's devastating because, well, it's not as prevalent as depression. The prevalence is only 1%. But it affects people in a very early age, late adolescence, early adulthood, when they only start their life. I often draw the parallel with Alzheimer's, and not to take away from Alzheimer's disease. But, at least these people have lived their life in most of the cases. Here, the people only start their lives, and they are affected by these grave, scary symptoms. And I also mentioned complexity. Well, complexity, because it's a very heterogeneous disorder. So you can have just one of these symptoms if it is bizarre enough. For example, you can have only bizarre hallucinations or delusions, and you will be diagnosed with schizophrenia. And someone else will demonstrate disorganized behavior and some negative symptoms like social withdrawal, poverty of speech, and will also be diagnosed with schizophrenia. So you have this, that's why I say that what we find might be true for the subpopulation. We don't know yet for who exactly. This is what we'll investigate. Okay, so I talked about the heterogeneity at the symptom level. Also at the abnormalities that we see in the brain. We see anomalies at the molecular level, at the level of receptor, different proteins, cellular level, and this is just an example of, you have tangled cells in the limbic system. And you have many anomalies at the structure of the brain. And most of them, overall, you have reduction in the gray matter volume, especially in the prefrontal cortex and temporal cortex, and temporal lobe structures like amygdala and hippocampus. Overall, there are also enlarged ventricles, and this is one of the most robust findings. There's over 100 studies that show enlarged ventricles in patients with schizophrenia, but it's not something that we can use for diagnosis. So, some of you might have huge ventricles and don't have any symptoms, and then there are some patients with schizophrenia who have very small ventricles and have severe symptoms. Just to show you that there is also a progression of some of these neural anomalies. So here you have early deficits. This is the brain, and the renderings of the deficits, the highest in the red, over the cortical surface. And 5 years later, in the same patients, You see the progression. So now we know, we knew for a while it's a neurodevelopmental disorder, but we also see some neurodegeneration. So this is, schizophrenia in a nutshell. Now, sex differences in the general population. And I wanted to start with one of the most exhaustive studies that was done by Goldstein in 2001, who looked at the 45 different brain regions in 21 females and 27 males. And basically, this is a summary, this is a slide, this is the rendering of her results. And I don't want to go to any details, but basically in this pinky red, you see regions that are larger in females relative to males, and vice versa in blue. She went for the gendered colors. You see the regions that are larger in men than in women. Now, there were many other studies that looked more at specific regions, not the entire brain. But overall, what is being found now in many studies is that women, and it's important to co-vary for intracranial volume, for height and weight. Obviously, the larger the brain, the larger the structures. But when you co-vary for that, you see that women show either larger volume, or some studies show the percentage of gray to white matter in all lobes of the brain. So frontal lobe, temporal lobe, parietal, occipital. There are details, but I don't want to go into that. Cingulate, gyrus, insula, and some subcortical structures like hippocampus, caudate, and thalamus. Conversely, in men, we have a greater white matter percentage in all of these, prefrontal, again, cortex, temporal, parietal, occipital, larger ventricles, larger hypothalamus, and amygdala. So, well, what does it mean? There are also studies that look at the complexity of the cortical area. So look at the gyrification. And again, there are sex differences. But does it translate into any function? Does it translate any differences in the brain function, in the behavior? And there's not too many studies that find correlation. There is one study looking at the total IQ that found that in men, the total IQ was correlated primarily with the parietal cortex, so with the volume of parietal cortex, whereas in women, it was more prefrontal cortex, especially Broca's area. And that kind of relates to the well-documented differences in visual spatial abilities in men, the superiority in men over women, which are mediated via parietal cortex, and superiority in women in terms of verbal language abilities, which are mediated by Broca's area. But other than that, there is not too much. When we look at the functional neuroimaging studies, I forgot to comment. I mean, it's actually a nice follow-up. Dr. Steiner presented more classical art. I like to present some art of the patients with schizophrenia, kind of interspaced with the modern art. So those of you who know your 20th century art will know which is which and others won't. So in terms of brain function, there are many studies, but they're pretty variable. Probably the most robust finding is in visual spatial abilities, specifically with the mental rotation task. And here, what has been shown in several studies now is that men, during performance of this task, activate primarily parietal cortex, whereas women activate, in addition to parietal, also prefrontal cortex for the same level of performance, as if they needed to work harder to have the same level of performance. And again, this is on average. I mean, obviously there are women who excel in visual spatial abilities and there are men that are dismal. But overall, that's what we see. There have been also behavioral reports of sex differences in word generation, in working memory, but we don't see too much in terms of functional neuroimaging studies. We see there are many studies of emotion processing that show differences between men and women. And when it started, we saw differences only because the investigation would focus specifically on the amygdala and other limbic structures such as hippocampus. So we saw primarily differences at that level. Then later studies started including more and more brain, and we basically see differences now all over the place. So anterior cingulate, orbitofrontal cortex, association cortex such as dorsolateral prefrontal, and even sensory cortex, even sex differences in visual cortex during processing of emotional stimuli. So it's not that surprising, really, to see these differences. Sometimes people say, well, so what do you make out of it? Why you use functional MRI and you have all these different results? Well, in case of emotional processing, it's true, because it's a very complex function. It's not, mental rotation, they're very similar tasks. You're just rotating three-dimensional figures, pretty similar findings. Here, sometimes the studies look at the positive emotion, sometimes at negative, sometimes these are visual stimuli, sometimes auditory, sometimes it's passive viewing, sometimes participants are required to make some decisions related to it. So it's not that surprising. Overall, when people try to summarize it, it seems that women activate more midline structures and men more lateral. And there are again some theories suggesting that women are more visceral and men more analytic in their emotional processing, but these are more stories. We don't really have too much evidence for that yet.